Be honest. Have you ever hooked up with a fellow doctor in the hospital? Grey's Anatomy style. Struck by lightning, stitching myself up, and hooking up with coworkers in the hospital. Brace yourselves because today I'm answering all of your most personal, wildest questions. All right, let's dive right in. Is it true you were struck by lightning? No. It was not me, but it was a relative of mine. My grandmother got struck in the butt by lightning, and she says that her hair changed color. She got lucky. She didn't go into cardiac arrest. Her heart never stopped, and she didn't get any bad burns, but she did get a little zap. Lightning can cause your heart to stop, go into VTAC or VFib, and it can also burn your skin really bad. So she got lucky, and she didn't have any of that. Have you ever treated yourself, like stitching yourself up or giving yourself a shot?
3 words for you. Treat yourself.
Yes and yes and yes. So recently had to treat myself, but it's only because I knew my body. And so I actually stepped on a foreign body, didn't know what it was, ended up being a pretty large piece of glass that was in my heel, had to kind of remove some of the skin around the area, and then ultimately take tweezers and grab the large shard of glass out of my heel. The only thing so far that I haven't done is give myself an IV, but I'm an ER doctor. We're good at the big IVs. The specialists are the nurses. Much better than we are. What made you start your YouTube channel in the first place? One, I would probably say the biggest push or the person involved would be my wife, Jen. She saw that there was a potential need for some medical information out in the world of the internet. And so we started a channel, and I saw it as a project to really educate individuals on what potentially you can do before coming to the hospital. I see how overwhelmed the emergency system is. It has turned into something really positive and, providing people with good medical education in an entertaining way. And now we get anywhere between like 30 to 40 million views a month. So really appreciate all of you watching. Thank you guys so much. Have you ever had a moment where your coworkers didn't know what to do, but you stepped up and have a hold my beer moment and perform masterfully? Sometimes, most common in the emergency department, if somebody needs help, it might be with a procedure. There have been moments where I've had to help a colleague out because a procedure wasn't going the way that they expected. Sometimes we have rectal foreign bodies that need to be removed, and I have long skinny fingers, and so sometimes I am called to help. Obviously, I don't wish this upon you, but would you rather be shot or stabbed?
Oh, it happened anyway.
Interesting. I think I'd rather be stabbed because it's a fixed blade, and so you know the exact direction where it's going. So I'm just thinking like a puncture wound. It still can go really deep and go in the body. You have a little bit more time versus like a bullet. It can go different directions, cause probably more injury, even though it's coming at you quick. Where it goes, it can, just hit more organs. So I think I'd want to be stabbed, but again, I wouldn't want either of it. I don't wish that upon anybody either. Am I dreaming, or do I sense a slight New York accent? Yes, there is a slight New York accent as I grew up on Long Island. I grew up in a town called Melville. And so yes, there is an occasional accent.
So Brooklyn's tough, but the Bronx is in the lungs.
Some words come out very New Yorkish, but when I do visit my family, I can tell they all have New York accents. I went to college in the South in North Carolina, then med school in Maine, and then Rhode Island for residency. And so I was all over the place, and my accent pretty much got neutralized. What's the absolute worst piece of medical advice that you've ever been given? I don't really have like bad medical advice. I remember I did break my back, but before I knew I broke my back, my father was like, yeah, suck it up, you're fine, it's just a pulled muscle. Other ones that I've seen come into the ER are a lot of times related to like burns and wounds, like putting toothpaste or egg on different wounds, and I'm like, don't put that stuff on there, increase the risk of infection, and it doesn't work. I asked before, but I'll ask again. Can you vlog on a day off? Here's my day off. This is me vlogging. I could, yes, definitely. On an ideal day, go outside, look at the sun for just a moment, get that circadian rhythm going, maybe relax, watch some TV while I'm having the coffee. Usually I'm catching up on my notes from work, and in that day will then include working out, doing videos for you guys. We do travel a lot, so we like to just hang out at the house when we're home. Today I'm actually doing this, and maybe I'll vlog a little bit because I am going out today. Dude, you seem jacked. Drop the workout routine already. I work out at least 3 times a week. I actually have a routine where I'm trying to do 5 times a week, which is push, pull, upper, lower legs, and basically the occasional like cardio. But a lot of times I'm doing a lot of walking. If you guys want me to really write down a routine, let me know. More comments about it, and maybe I'll give you guys a routine. What's the worst hospital that you have ever worked in and why? Throw a hospital under the bus. The worst hospital I worked in was a hospital that was struggling financially and didn't have the right staff, where doctors would have to transport patients, they would have to discharge their own patients, sometimes couldn't find staff members to give meds to patients. Like, literally was not a good scenario, and ended up only working there for a short period of time. It doesn't mean that doctors can't do those things, but it's not a good use of their time when other individuals have roles like that that can help. Be honest. Have you ever hooked up with a fellow doctor in the hospital? Grey's Anatomy style. No, never hooked up with a fellow doctor in the hospital. No. But I've heard stories, nurses hooking up at the hospital and people ended up getting fired, I believe. So you really can't do that. It's like any workplace. You can't have relationships that would take you away from like patient care. I mean, you can have relationships with people at your work, but you have to make sure that like human resources knows about it and everybody approves it, those sorts of things. What's a decision you made that completely changed the direction of your life? I've had a lot of unique things that have happened that led me to where I am right now, and I wouldn't change any of it. But I wish my mother was here to see all that stuff. Would I say my mom passing redirected? No, but I think part of the reason why my mom passed away, she was diagnosed with cancer in 2001. And so I was an undergrad at the time, and it really helped push me to go into medicine. Are you friends with other big YouTubers? I know some big YouTubers. In general, I work a lot, so I don't get to get out and mingle and collab that much. Don't really get the invites that often to YouTube events. But, you know, Coyote Peterson from Brave Wilderness, you know, I'm friends with him. Also friends and friendly with Houston Jones and Noah from Mortal Kombat, Gameology, the Gameology crew, Cameron. What were some of your early jobs before becoming a doctor? I was a camp counselor for soccer. I was a trainer for soccer. I was also a cook at a restaurant. So I went into a restaurant looking for a job. I was a dishwasher for 24 hours and then became a cook at a steakhouse and did that for many years, actually. Then I was an EMT. Then I worked in a fire department and then went to medical school. But before medical school, I was also a pharmacy technician. How cool is that? What is the hardest part about your job in the emergency department? I think the hardest part is not screwing up, in the sense of my job is to rule out the scariest, worst case scenario, save lives. And I think every ER doctor wants to always do their best and get everything right. And so we really, maybe don't fear it, but we're really aware of not missing something and trying to make sure that we rule out all the bad things. There are times when you don't get the right or the exact diagnosis, but you really want to make sure that you don't miss something that it could be catastrophic for an individual. Wow, great questions, you guys. You know, I really like this. I give a little glimpse of me on a personal level. Please continue to send them my way. If you guys enjoyed this, definitely check out this playlist right here, Binge Watch Everything. Please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.